Hi, I'm Dr. Megan Trester, one of the physicians at Moreland OB-GYN. I'm here to talk to you today about coronavirus or COVID-19. I specifically wanted to discuss some of the changes that our clinic has implemented to help promote your safety and health during this difficult time. First of all, we've been rescheduling all of our non-emergent office visits. This includes annual exams, routine GYN appointments, or GYN appointments related to non-emergency issues. If you do have a health concern and wondering if you need to be seen, please call our office to discuss with a nurse and determine if an appointment is appropriate for you at this time or whether it should be scheduled into the future. At our clinic location, we now have nurse screeners who are available to screen all of our patients as they enter the clinic to ensure that we do not allow a sick patient to come into our clinic and possibly expose our staff as well as our patients that are in the waiting room. In general, there's been a lot of different questions about how COVID-19 or coronavirus affects pregnant women. The quick answer is that we don't really know. From the research that we are seeing coming out of other countries, it shows that there is unlikely a risk of the mom transmitting the infection to the baby while she's still pregnant or through breast milk. However, this data is very limited. Since coronavirus is spread by respiratory droplets, the highest risk way of transmitting to a newborn is actually after the baby is born. So please be careful if you're sick at the time of delivery. I wanted to review with you some common symptoms of coronavirus or COVID-19. The most common symptoms are fever, cough, shortness of breath, or possibly GI symptoms. These symptoms can appear 2 to 14 days after an exposure. If you develop emergency warning signs, we want you to seek health care immediately. Those signs include trouble breathing, persistent pain or pressure in the chest, new confusion or difficulty aroused, or bluish lips or face. If you think that you may have been exposed to the virus or you've developed symptoms, please call our office so we can have you speak with a nurse and determine what precautions or whether you need to be evaluated for these symptoms. At this time, Moreland OB-GYN is not offering testing at our clinic locations. The best way that you can protect yourself is to stay home as much as possible. Wash your hands frequently. Minimize exposures to anyone outside of your immediate family. There are lots of different resources on the internet and social media talking about coronavirus. Some is more accurate than others. If you have questions, we encourage you to refer to the CDC website for any information. Many of us, myself included, are trying to work from home when we can and have small children who are at home as well. It's important for you to be a good leader and talk to them in an appropriate manner about coronavirus. First of all, remain calm and reassuring. Kids react to what you say and how you say it. Make yourself available to your children to listen and talk about coronavirus. Pay attention to what your children are seeing or hearing on your radio or television or online. Too much information can cause anxiety for children. You want to make sure to provide information for them that is honest and accurate. Be sure to account for their developmental level and age when you're discussing these topics with them. And most importantly, teach children everyday actions to reduce the spread of germs. Remind them to cough or sneeze into a tissue or into their elbow, then throw the tissue into the trash, and then wash their hands immediately afterwards. It's important to get children into the hand washing habit. I encourage you to have the children sing ABCs 2 times through while they're doing their soaping. Other times that they should wash their hands: after they cough, after they sneeze, after they blow their nose, before meals, or before helping to prepare meals. After the bathroom is also important. I know it's hard for all of us to keep track of everything with children at home as well as coronavirus, but we want to make sure that everybody is doing everything they can to stay healthy through this time. Take care.